It may look like a strange instrument, but it is something that has proven useful in many areas of medicine. This long, flexible tube with a lens at one end and a video camera at the other is called an endoscope. An endoscopy is a medical procedure that allows a medical doctor to inspect and observe the inside of the body without performing major surgery. Prinesta Hanyanga, a young girl from Kafue district, is here to undertake this procedure. Early October this year, Prinesta started complaining of stomach pains, a situation that has brought her here at the Levy-MMU University Teaching Hospital.
1 week twakede ku UTH waliwo yitwa amatest andene kusigala mwinsu nkalija n'obuno Levy-MMU kuba twambiwa matubole tujite test ya endoscopy aro wamba tibagagulanganya kuno nchiziji janige jini chipati bayandawula kuchita establish chipa kuti nobulaga bumana chinzi ipenzi njaono mwana tairia ga indipepe wali utalika pa 7 October
ngandi hako katara jizwezwe kutinanda enda uraho ndovyo.
Since the introduction of the endoscopy medical procedure at the Levy-MMU Teaching Hospital, the work of health practitioners has been enhanced. Being curious of how this procedure works, I visited Dr. Bright Sokolo, a consultant physician at the Levy-MMU University Teaching Hospital.
The Ministry of Health and the government of the Republic of Zambia signed a memorandum of understanding and equipment came through. So about 2 years ago, that's when we started. And so far we've done quite well. We've got modern equipment, one of the best in the country, and of course when you talk about picture clarity, we would say we are probably the best. So because of transmission of the picture onto the screen, so many other doctors and other medical personnel, the nurses and so forth, they're able to participate in the procedure. And you know, 2 brains, 3 brains or 4 brains are always better than one. So when you are the 5 of you, all of you can participate in the procedure such that the chances of a patient getting the best outcome are really very high with this kind of equipment, because everyone participates. Everybody will be looking at the screen to see what problem the patient could have. Of course, you have one person who is controlling everything, but others can also participate and help the main person who is doing the procedure.
Mochanga Stanley Hamasago is another patient waiting to access endoscopy procedure. He has come all the way from Kafue district. What has brought him here is failure to swallow solid food. The introduction of the endoscopy procedure at the Levy-MMU Teaching Hospital has helped save many lives. In a day, the hospital sees over 10 people, a situation which was not the case before the introduction of the endoscopy procedure.
It has really enhanced our work very well. In the past, we couldn't attend to most of these patients, especially the bleeders. Those who come through with a history of bleeding, you would find that you can't do much. You can't know why they are bleeding. And because of that, sometimes we end up losing patients. And then there are other patients who can't swallow. Find that you can't tell why they can't swallow. So all those problems with the coming of endoscopy, we are able to do that. And we are saving the entire country because it's a public institution. We have referrals from all over the country coming through to our institution. So really it has enhanced our work, and our work has been made quite light. It's much lighter than it used to be in the sense that we are able to make diagnosis and manage patients appropriately.
Prior to the performance of the procedure, an endoscope must be carefully cleaned and disinfected.
Washing machines for endoscopes. They sterilize the endoscopes for about 10 minutes. In 10 minutes time, then the endoscope is ready. They're quite effective, and actually we are the only ones in the country so far that are using machines to sterilize our equipment. it's much faster, and our nurses don't have to spend time cleaning and everything. This is automated. So we just put in there and then you leave it. After 10 minutes it's ready, you take it out. So this can see here, already filled. It's now being dried up. So it's now at 7 minutes.
The endoscopy procedure is a major advance in the treatment of gastrointestinal diseases.
Our reports, computer generated, and we're able to store them for a very, very long time, such that even 10 years from now, if the patient wants the report, we can still print for them and we give them. Because sometimes we need a reference. Maybe another doctor somewhere wants the report of what was done earlier, so we generate them electronically.
It is painless procedure, though may still cause some discomfort. Gina Mdenda Mwenya for the detail.